Let us discuss monoamines now. We will be talking about acetylcholine, dopamine, norepinephrine, and serotonin here. Acetylcholine is mainly excitatory in the brain. It is the transmitter released from motor neuron nerve endings at the neuromuscular junction and at collateral axon synapses with Renshaw cells in the spinal cord. The excitatory effects of acetylcholine on central neurons are usually mediated via muscarinic receptors, predominantly of the M1 subtype. Nicotinic receptors are also present in the brain. They have a different subunit construction, take alpha-4 beta-2, from peripheral receptors, and a different pharmacology. Most central nicotinic receptors are presynaptic and increase the release of many other transmitters. However, their only known clinical importance is in nicotine dependence. Cholinergic neurons are particularly abundant in the basal ganglia, and others seem to be involved in cortical arousal responses and in memory. Atropine-like drugs can impair memory, and the amnesic action of hyoscine is made use of an anesthetic premedication. They are also used for their central actions in motion sickness and Parkinson's disease. Loss of cholinergic neurons and memory are prominent features of Alzheimer's disease, for which there is no effective treatment at present. Donepezil, galantamine, and rivastigmine are anticholinesterase of modest benefit in up to 50% of patients with Alzheimer's disease. Dopamine generally inhibits central neurons by opening potassium channels. Dopaminergic pathways project from the substantia nigra in the midbrain to the basal ganglia, and from the midbrain to the limbic cortex and other limbic structures. A third, tuberoinfundibular, pathway is involved in regulating prolactin release. The nigrostriatal pathway is concerned with modulating the control of voluntary movement, and its degeneration results in Parkinson's disease. The mesolimbic pathway is overactive in schizophrenia, but it is not known why. Dopamine agonists are used in the treatment of Parkinson's disease, and antagonists, neuroleptics, are used in schizophrenia. The chemoreceptor trigger zone, CTZ, has dopamine receptors, and dopamine antagonists have antiemetic effects. Norepinephrine both inhibits and excites central neurons by activating alpha-2 and alpha-1 or beta receptors, respectively. Norepinephrine-containing cell bodies occur in several groups in the brainstem. The largest of these nuclei is the locus coeruleus in the pons, which projects to the entire dorsal forebrain, especially the cerebral cortex and hippocampus. The hypothalamus also possesses a high density of noradrenergic fibers. Norepinephrine and dopamine in limbic forebrain structures, especially the nucleus accumbens, are involved in an ascending reward system, which has been implicated in drug dependence. Ascending noradrenergic pathways are also involved in arousal, especially in response to unfamiliar or threatening stimuli. Depressed patients are often unresponsive to external stimuli, with low arousal, and impairment of noradrenergic function may be associated with depression. Norepinephrine in the medulla is involved in blood pressure regulation. Serotonin, 5-hydroxytryptamine, 5-HT, occurs in cell bodies in the RAF nucleus of the brainstem that projects to many forebrain areas and to the ventral and dorsal horns of the spinal cord. The latter descending projection modulates pain inputs. 5-HT pathways are involved in feeding behavior, sleep, and mood. 5-HT may, like norepinephrine, be involved in depression. 5-HT3 receptors occur in the CTZ, and antagonists have antiemetic effects. 5-HT1D receptors occur in cranial blood vessels, and the agonist sumatriptan relieves migraine by constricting the vessels that are abnormally dilated during the attack. 5-HT is involved in the control of sensory transmission, and 5-HT2 agonists, for example LSD, cause hallucinations.